Cryoablation is a minimally invasive procedure that allows us to help patients maintain normal rhythm and not have an irregular heartbeat. The irregular heartbeat can often cause symptoms such as shortness of breath, fatigue, decreased energy levels. All of these things decrease an individual's quality of life. So the pulmonary veins bring blood from the lungs to the left atrium. And what we know is electrical activity that can spontaneously occur in the pulmonary veins can then travel into the left atrium and make one go into atrial fibrillation. And this is why we target this area and want to cause a very small and purposeful damage to the heart cells in hopes that this can no longer occur. The freezing in good contact with the cardiac tissue causes a minimal amount of targeted damage to effectively change the substrate of your heart and to prevent the triggers that actually initiate atrial fibrillation or the irregular heartbeat. One of the advantages of a cryoablation approach for atrial fibrillation is the procedural time tends to be reliably much less than that of the traditional radiofrequency ablation approach, which is essentially heating up the tissue instead of freezing the tissue. The procedural times on average are typically half as long, which means half as long under anesthesia and theoretically less potential complications that can occur from lengthy procedures. Allegiance Health has invested considerable time, energy, and funding for the development of an atrial fibrillation program specifically utilizing cryoablation technology. The decision on whether or not to pursue with a procedural approach to manage symptomatic atrial fibrillation is done primarily by an electrophysiologist, although is done in coordination with your general cardiologist as well as your primary care physician. Primary care physicians and all cardiologists have tremendous experience with atrial fibrillation, and then they are the ones who often prompt the referral to an electrophysiologist who then does the procedure.